Maria's going to challenge you here. She says, yeah, she used to smoke, but she has no diabetes. She has normal cholesterol, family history, has, what does this say? I can't read what it says, but, of PAD, but not to the extent of what she's experiencing. What else can she do, aside from that? I mean, exercise, food, diet. I mean, it is the best thing you can do in
I mean,
order to
yeah,
improve prognosis.
if it's the question is it with the smoking, did it cause pruning of all the vessels down low? If that's the case, then you keep trying to do exactly what everybody else is doing as much as tolerable, which is the medications, the diet, the walking, forcing yourself to push yourself. So, we got to be honest with ourselves. Sometimes there's not always a magical cure. The question is, what can we do to keep improving little by little to sustain the quality of life? Are there spine stimulators for the pain to help you move better? Some of those spine stimulators have been shown to cause the blood vessels to actually open up a little bit. There's some data on that. So I'm not sure if that's something that's been entertained, if it's a pain issue keeping you from being able to function. That doesn't work for everybody, and there's issues, but you have to kind of keep crossing things up the checklist of things that you can do or someone can help you with to help you do things more that you're doing. So it's a little tough to say what's going to be the magical cure without knowing what the images look like, knowing what the status is. But sometimes it's still trying to optimize all these things. And people say, oh, how can I lose weight when I can't walk? It's a tough question. It's a fair question.
Mhm.
It's still working on the diet, still working on whatever movement in a chair that you can accomplish with the little pedals under your chair. It's whatever is something more than current.
We always suggest getting with, a hematologist, getting with a dietitian, and pushing for more advanced blood work because there could also be some additional nutrient deficiencies. For
Yeah.
my dad, it was an MTHFR mutation, which is
Yep.
not talked about as much yet. It's on the American Heart Association's website as something that should be looked into if you can't find any other explanation. It's a gene mutation that makes it struggle for you to turn food into fuel. And so some of your vitamins are not absorbing as well as they should, leading to a particular enzyme known as homocysteine to elevate. And it's like nails on your artery wall. You have damage to your arteries, and that's going to trigger the inflammatory response. So that could be an issue. There could be genetic clotting disorders. There's so much more, right, Dr. Madassery, that can be
Absolutely.
looked into. And it's just up to you to advocate for yourself because, doctors don't always do this until you ask the right questions. You've got to advocate and make sure that you're getting the answers that you need.
There's studies going out. There's people doing beetroot juice studies for PAD. There's a lot of different things out there to try to see what else can help when nothing else is really, or is there some things that are natural that can help you? So go drink beetroot juice. It's not going to hurt you no matter what. There's instead of waiting
Chia
10 years for
seeds.
something.
So this one's interesting. You're going to love this, Dr. Madassery. So we had a patient that we're always talking about. I grind my chia seeds. I put it in everything because I know that the health benefits of it. But one of my patients came to me and said her friend told her that if you're on blood pressure medications, you shouldn't be having any chia seeds. And so I went to one of our cardiologists and I said, so what's the deal with this? And he kind of laughed and he was like, actually, I shouldn't be telling you this, but if you eat a lot of chia seeds, it works so well that it interferes with blood pressure medication and insulin. So some of these natural means could actually make a difference. And so instead of just depending on pills, if you haven't been put on pills yet, start on some of these natural means. We even have Dr. Antizana, who's Nancy's doctor, who prescribes Ceylon cinnamon capsules. And there are studies you can look at online because he says it not only it helps mainly lower the A1C for those who are
Hmm.
type 2 diabetics, but he said that it also may have some impact as well on the LDLs in your body. And there are studies out there. Always check with your own doctor. Don't take any advice or information and act on it from here. Check with your own doctor. But it is something that's interesting that he's a vascular surgeon, said, hey, Ceylon cinnamon. So I'm seeing more and more doctors looking for more natural means to assist patients in becoming better partners in their care.
Yeah, I try to tell everybody, let's not assume there's a magical treatment for this. We're playing catch up to 10, 15, 20 years of disease buildup.
Yep.
You didn't typically get a heart attack from one burger last week. You got it from a buildup of plaque. Same thing. You didn't get the leg attack from just, your sugar spiked yesterday. So we're combating something that's been building up for so long. Now is what can we do that's least invasive, that causes the least amount of damage and risk to you, but understanding that this is a long-term issue that's been there. You just didn't really know. That's kind of
And
the
we
hard
just
part.